Hi, Melanie Chris with Telehealth Share, wanting to talk to you today about intervention planning. I know that for many of you, that task of intervention planning for telehealth sessions can be extremely daunting. I think back the to several moments more than 10 years ago when I started doing telehealth and did not have mentors in the area of school-based practice, did not have access to mentors to really, or resources to help me with those planning sessions. And it was certainly a challenge as I created those plans for each student. And at that time, at the very beginning, my plans were very individualized. I planned session by session by session. I had very little kids at the time. And after they would go to bed, I would stay up many late hours trying to come up with the best plans that I could for my sessions the following day or in the following days. So over the years, I have discovered several tips that have been very helpful for my intervention planning. And one of those things that I want to show you today is using an occupational therapy, or something similar to this could be used for other professions as well. This is just an occupational therapy example of a plan of care. And now my practice has been with school-based practice, and the last 10 years has been with students K through 12 that have or are attending online education programs. And this plan of care has really helped me to have a go-to list of occupations or activity ideas to utilize during my sessions with students. And I would encourage you to utilize something like this plan of care, as well as a PowerPoint template of some kind. And I have, over the years, created several PowerPoint templates, one that focused on this education task of keyboarding, for example. And I found my favorite keyboarding sites and my favorite warm-ups for, to do before and after. And I have a master PowerPoint for some students who are really working on some handwriting needs. I have a master PowerPoint for just exercises and warm-ups, engaging and fun exercises and warm-ups. And I had a master template that guided me, and Jana Kaysen recently did a video on one that she has used, just a general pediatric PowerPoint template for guiding you through sessions, with starting, with some warm-ups and progressing through, warming up for the fingers, warming up, for the arms, warm-ups for the eyes, warm-ups for our body, functional activities, functional tasks. So coupling a plan of care like this with perhaps a PowerPoint that you can use across multiple sessions. And once you get to a certain point on this PowerPoint, make a note of where you've left off, and then come back the next session, where you want to pick up where you left off. But then coming up with those occupations and specific occupation-based activities, educationally relevant for those of us working in school-based practice, tasks, coming up with those interventions to build into pieces of that PowerPoint can be extremely helpful if you have a reference, a guide of a whole bunch of an ongoing running list of interventions for various areas. So that is where this OT plan of care comes into play. The first couple of pages I'm going to show you here are really some background information. I would complete this for each of my students and have some, basic information, the date I completed the plan of care, of course, a student name, grade, date of birth, school, caregiver name, a phone number where I can reach them, so that if, the internet goes out and I don't have access to it, I like to have a printed copy just in case I need to reach someone. And of course, then my information, and then the goals, their OT goals. And then how are we going to go about, what are we going to be addressing? What areas of occupation are we going to be addressing? And just clicking the box that applies. What performance skills are we targeting? What intervention approach are we using? What types of intervention are we using? What are some of our outcomes that we hope to see? What is the service frequency? And what are the due dates? When are we going to be really reviewing and modifying these goals? When are we going to be looking at some of these things? And then the name, of course. So this is a nice, covered area, a nice section to have some of that basic information for quick reference for what our plan of care really is. And then the following 5 pages include so many different intervention ideas that you can use during your telehealth sessions. This is obviously not an exhaustive list. There are so many more things. As OTs, we are so creative and can come up with so many wonderful ideas of things to do to address various areas of concern. The way I use this, and I encourage my OT team with community therapy services to use this, is to identify what the problem list is for your client, and then simply delete what doesn't apply. So let's say for this student, if the problem areas really are executive functioning and activities of daily living, I would just delete what doesn't apply, what our focus is not on. And so then, we're not going to be focusing on our visual motor section, or the fine motor section, or the visual perception section, or the handwriting section, or the keyboarding section. So what we are going to end up with is the executive functioning and activities of daily living section on our plan of care. So that then as I'm planning for future sessions, I'll go back here and say, have I tried this? Maybe I'll try this week. And it's just a running list of things that you can do with your students during the sessions. And the types of items in here, there are a lot of websites, many of them with free resources to help you in those particular intervention areas. So some of them are websites. There are some things that may be referenced that would be available that I've used and found very helpful that are available for purchase, and I put links in there for some items. There are also some items that would require most likely purchase, like WikiSticks or Play-Doh. Several things in here are items that the family could find, around the home if you don't have the opportunity to send out OT toolkits. We have that wonderful opportunity to be able to do that. So our OTs and our students have the same supplies. So in this document, the hope is that you'll just have a running list of intervention ideas, like a go-to list to just start really getting you to think about possibilities for your sessions. And then it's a Word document, so you can just add to that as you go. Now, you can create something like this on your own. You can create a plan of care document very easy with Word and add some of these pieces, some of these important pieces, and add your own intervention ideas. If you would like access to this specific document, it is available on telehealthshare.com for purchase, and at a few dollars for this. And so it's really, the intervention ideas are a compilation of ideas and things that I've added over the last 10 years of practice. But again, I would add to it as as I found more resources and more ideas, and that is something that you can do too. Create your own to help you, that go-to intervention list, or perhaps go on to telehealthshare.com and use something like this to help you with your sessions. We at Telehealth Share are really excited about the opportunities that we've had to share some of these resources with you. And if you are a therapist or know of a therapist that has great ideas to share, that you want to share with others to help with their telehealth sessions, please reach out to us either in the contact us section on our website, or there is a seller info tab on our telehealthshare.com website, and it will give you the instructions for uploading any documents you'd like to sell or share. So we would love to hear from you. We would love to partner with you, because our goal really is to provide resources to our telehealth share community to help you to implement meaningful, engaging, creative telehealth sessions. So we're looking forward to sharing more with you. I hope that this may be helpful to you as you prepare and to plan for your telehealth sessions.